asking for pampatunaw ng liver, tumor liver. Tumor, yeah. So, if you talk about tumors, if you talk about tumors, generally in medical terms, tumor means just an enlargement, ano po, like a new growth, yun po. So it doesn't really tell you if it's cancerous or benign. So pagka may mga tumor, pag may mga enlargement po tayo or tinatawag po natin na new growth, so maraming dahilan, okay? So you have to ask your doctor first, what's the most common reason bakit nagkakaroon ng tumor mass, ano? One of the most important risk factor of developing liver cancer, it's hepatitis B. So if you have hepatitis B, you would usually have, you would develop liver cancer eventually around 200 times higher. 20 to 200 times higher. So, kapag nagkaroon ka ng hepatitis B, almost always nagkakaroon din sila ng liver cancer, di ba? Nakakatakot. Also, if you are drinking, so if you're a chronic alcoholic drinker, and some medications also that you are taking in, some medications for the that you are taking in for maintenance, you would also develop some types of liver tumors.
Well, there's no medicine, no medication that doesn't have a side effect.
Yes, parasitic infection also. Pagka meron ka mga schistosoma, yung tinatawag po nila. And you can also develop some form of, or amoeba. Yeah, amoebic. Yan, pwede ka rin magkaroon ng tumors because of this condition. So, what you can do is that, as a herbal, in herbs, you can use garlic. Yan. Pinakamaganda ho dyan, garlic dandelion. Yan, mga milk tea, magagandang herbs for the liver. And of course, mega-dose vitamin C. That's what I usually do, especially if there's a damage in the liver. The mega-dose vitamin C will help you a lot. And garlic. And then, if it's damaged, you do an SGPT, SGOT testing after 1 month. So, you see if there's a result. Okay, for liver damage, doc, please advise. Now, for liver damage, you have to identify first what is the reason. Like I have been telling people before, the more common cause of fatty liver is usually food, drugs, viral infection, or you can also have fatty liver damage because of alcohol and cancer. Now, if it's fatty liver, which is the first sign of damage to the liver, it is reversible. So, you can still, as long as you remove the offending agent, okay? But if you do not remove the offending agent, of course, it's gonna progress to hepatitis to cirrhosis. And of course, if you have cirrhosis, you are 20 times more prone, 200 times more prone to developing liver cancer. That's why it's important to fix, okay, or to cure if you have a liver problem. Now, you can use garlic and mega-dose vitamin C. Also, you can use dandelion, milk tea, yan. So, this can help you as well. Vitamin C, okay? Again, if you look at the label, you can see the recommended dose is only 1 grams per day. But I have always been an advocate of mega dosing of vitamin C. So this is a suggestion for all of you. So what is mega dosing vitamin C? It's around 5 grams up until 25 grams or 30 grams per day. Okay? So, makikita nyo.
Paris, California.
Yeah. So, makikita nyo, diba may mga teaspoon sila dyan. Makita nyo naman in the label, diba? So, you see that one teaspoon of vitamin C it's equivalent to 5 grams. Okay, so if it's 20 grams of vitamin C,
It would be about 4 teaspoons.
Okay, again, ulit-ulitin nyo na lang, just review this, just do the replay of this video, okay?
Which basically, since we had to start a new video, the watching and interacting with this video does not constitute or initiate a doctor-patient relationship with Dr. Farrah. The information being provided by Dr. Farrah should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this broadcast or on any website or other medium of any kind associated with Dr. Farrah, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it.
Okay, so that's it. Again, what will you feel if you have been taking mega dosing of vitamin C?
Loose bowels.
So you will have loose bowel movement. Okay, so magtatai po kayo. So when you come and then maybe you will be saying like, Doctor, bakit ako nagtatai? It's normal for people to have diarrhea, especially if you are on mega dosing of vitamin C. But if you ask me if vitamin C can cause any adverse reaction or any stones, formation of stones, no, it doesn't. I have never demonstrated that in the 16 years ko. Huwag ko kayong magagalit sa akin. Kasi mamaya, most of you, they will be upset with me like, Doctora, why are you advocating vitamin C when you know it's bad for the kidneys? No, it's not bad for the kidneys.
I will say this right now. There is no single study in the history of medical literature that shows a causative effect of vitamin C in excessive dosage causing kidney stones. There's just not. A lot of people think there is, but there's not.
Okay, so next is your mega dose vitamin C. Okay, so the mega dose vitamin C here. Yeah. Mega dose vitamin C is a better vitamin C. Why? So again, the packaging is a lot better. Okay. And it's a more concentrated and more potent vitamin C. Okay, so nandiyan din po yung serving nila. Serving. So, yung nakalagay po sa mga serving, these are just recommended or suggested use. Okay, especially to some of my clients. Back then, some of my patients, when I left the country, some of them, I would give them high doses of vitamin C. So you can always, you can always ask me. So if you're very interested with it, just go to drfarrah.com. Go there, so you can order, or also you can also order in.
They're any of our distributors.
Yeah, with our distributors.